It's amazing what can happen when you finally feel confident enough to smile. For Phyllis, that confidence came back after years of dental challenges, thanks to Dr. Azer and his team at Texas Dental Implant Center. Hello there, Phyllis.
Hello.
With your bright lipstick.
Well, thank you. I love the red.
Yeah, because at one time you just wouldn't wear lipstick.
No, but now with, the new smile and everything, red lipstick makes it pop.
Yeah,
Whatever
it takes. But really what she's saying is she has
amazing.
confidence now.
Yeah.
Oh, yes.
I saw Phyllis on the day of the consult. She told me, I've had a lot of oral surgeries and then I hated it. And I told her that's not the case anymore.
Yeah.
You're going to go to sleep and wake up with a brand new smile.
Yeah, and that's because of your training. Let me just say, not all dentists do the same thing. It's not that one dentist is better than the other, but they're not all trained to do the same thing.
Yeah.
And in fact, a lot of dentists, when someone's opened their mouth, said, okay, this is more complicated than we were thinking, a lot of dentists will send their patients to you for some of those difficult cases.
Yeah, I think part of it is our training. We specialize in dental implants. So a lot of patients who came into our consults and they were told that the process will take 9 months to a year. And part of it is that a lot of the general dentists are not trained to do the advanced implants. These are longer implants that anchor to areas where the bone is present. And that's exactly what happened with Phyllis. So there's no sinus grafts or bone grafts that we need to wait for a long time. And the results are almost instant.
Yeah. For a lot of us, our problems with our teeth is just plain old age. We're outgrowing our teeth. We live longer today, and we got to realize that we're just like our hips and our knees and all that stuff, we outgrow our teeth. So at some point, we might have to come in and just get the slate wiped clean and start over again. Not all over, but make sure we maintain them. But for you, Phyllis, you had teeth issues, dental issues from an early age.
Yes, so I was 2 the first time I had my first major restorative oral surgery.
Wow.
And so I have lupus and I have Sjogren's, that's autoimmune disorders, and they basically, it's where your immune system kind of attacks your body, and it broke my teeth down from a very, very early age, and it just continued even after my permanent.
We're looking, those are your
teeth
pictures
came in.
right there?
Yeah.
Wow.
That's me.
That is crazy. So battling, the Sjogren's and the lupus is one thing, but also not feeling confident and putting forward, your best, that had to do another number on you.
Absolutely, absolutely. So it was really hard before, I never smiled. I had a hard time making friends. I had a hard time being social. I would consider myself an introvert. And what I've come to realize since getting this done is I'm not an introvert.
No, you're not.
I'm a social butterfly. I just want to be friends with everybody. I just was shy.
What was your breaking point where you said, I have got to stop chasing? Because that's what, Dr. Azer, a lot of people kind of chase things and do a lot of patchwork in between. They waste a lot of money doing that, a lot of time doing that, as opposed to just getting the most permanent thing done.
Yeah, I think one category of our patients are the ones who are wearing partial dentures or they have decay, and they keep losing a tooth one by one every year. And then they keep chasing, like, I'm going to put a crown this year and then another crown another year. And then the system doesn't fall in place after some time. And that's where it's time to say, stop, I'm going to take a stance here and then start a full mouth reconstruction at the same time. So all the teeth are in harmony, they look at the same size and shade, and that's exactly what the final result will look like.
What was your breaking point?
So for me, I had been through so many oral surgeries, and the very last reconstructive one I had ended up with me having a partial denture, and I was still in my 20s at the time. And I was like, I can't do this anymore. I don't want to have a full denture before I'm 30. I cannot deal with this anymore. I need something better. And so did my research, saved my money, and I got really lucky, really blessed that I ended up with him because, I couldn't ask for a better oral surgeon, really. I couldn't have asked for a better job done.
And that's because you truly love what you do. But she talked about that partial denture. The problem with dentures is that you still continue to lose bone, and they're not as stable. You get into the implant, and you can actually have your bone grow, and then it's much more stable. So take us through the process. When someone comes in, you obviously, not everybody's the same, right? So you go through a whole program for somebody, what they might need to repair their teeth. But they're not all the same. But the implants themselves, take us through how that's done.
So on the day of the consultation, we do a scan of the mouth, with or without the dentures, and then I sit down with the patient and explain to them where their bone is and what the future smile will be. So we do a digital smile design where we pull up on the computer all the scans and put the pictures together and then give them a proposal of what the teeth are going to look like. A lot of patients who are in dentures, they don't know where they can be, or they feel like dentures is the end point because there's nothing else to do. But with implants, I mean, we're growing the bone back. If not, then we're protecting your bone from resorbing, and that protects the rest of your facial features.
Yeah, yeah.
And then from this to surgery day, and then from surgery day to your teeth.
Yeah, and then you have like a one arch procedure that you have developed.
So the one arch is a proprietary sequence of treatment that we developed at Texas Dental Implant Center. Previously, we used to do a denture that we glue it to the implants, and what we realize is that the process is much slower, and then the teeth with dentures, if someone watching this now, they may say that, oh, dentures are huge, they feel like bulky. So with the one arch, everything is computer generated. So once we have the surgery done, all the records go back to the computer, and then we get a proposal with the teeth being in. So everything is super clean. There's no more of the doughy stuff. So that's where we stand now.
Yeah, and so you mentioned that you saved your money. What you got in return is something priceless. I know that's one thing that stops people at the doors. They think, how much is this going to cost? You will work with them, but there's also different procedures you can do. And one of the reasons why you might not cost as much as someplace else is that everything's under one roof with you.
Correct. So we do have our lab in-house. That serves for many purposes. One, it's a faster process for us. Two, we have full control on the shape of the teeth and the shading. And then three, it helps us to keep the cost down.
Yeah. All right. What do you have to say to someone who is putting it off?
Just get it done. It's worth it. I mean, just go see Dr. Azer. It's so worth it because it changes everything.
Yeah.
It really does.
The Texas Dental Implant Center has an offer for you. The first 20 callers will receive a complimentary consultation with Dr. Azer and a free 3D scan after a pre-qualification call. Call now to schedule your appointment. That number is 346-1-ARCH. That works out to be 346-663-2724. Again, 346-663-2724. To learn more about the Texas Dental Implant Center, visit bestdentalimplantshouston.com. Even if you've been told you don't have enough bone for implants, remember Dr. Azer handles severe cases as well.